Welcome back to Health Hacks. Previously we already talked about what is mesothelioma and its symptoms. You can check it in our list. In this video, we will talk about the treatment and its prevention. When to see a doctor. Mesothelioma symptoms can resemble those of other conditions. Therefore, it is important to seek medical attention promptly if you experience the above-mentioned symptoms, particularly if you have a history of asbestos exposure. Diagnosing mesothelioma. To determine a diagnosis of mesothelioma, the doctor will engage in a question-and-answer session regarding the patient's symptoms and medical history, especially regarding potential asbestos exposure. A physical examination will also be conducted to detect any lumps or other symptoms. To confirm the diagnosis, the doctor may perform imaging scans such as X-ray. This helps detect thickening in the lung lining, fluid in the pleural cavity, or changes in lung shape. CT scan. This examines the chest and abdomen areas, detects the presence of cancer, and checks for any spread to other organs. PET scan. This provides detailed images of suspected cancerous tissues. MRI. This offers a more detailed view of organs and helps determine the tumor's location. Based on the test results, the doctor may recommend further examinations, including blood tests. These are performed to detect elevated levels of fibrillin-3, osteopontin, and peptides in the blood, which are typically higher in mesothelioma patients. Fluid sample analysis. If there is fluid accumulation due to mesothelioma, the doctor will take a sample of the fluid and send it to the laboratory to detect the presence of cancer cells. There are several types of fluid sample examinations, including thoracentesis, fluid sampling from the pleural cavity in the chest. Paracentesis, fluid sampling from the peritoneal cavity in the abdomen. Pericardiocentesis, fluid sampling from the pericardium, the membrane around the heart. Biopsy. A biopsy involves taking a tissue sample from a specific part of the body for analysis in the laboratory. There are several types of biopsy examinations, including needle biopsy. A long needle is inserted into the chest or abdomen to obtain a sample. Thoracoscopy, laparoscopy, and mediastinoscopy. These biopsies are performed by inserting a flexible camera tube and specialized surgical instruments through one or more small incisions. The type of biopsy depends on the area being examined. Thoracoscopy, to examine the inside of the chest. Laparoscopy, to examine the inside of the abdominal organs. Mediastinoscopy, to examine the area around the heart. Biopsy through surgery. In some cases, the doctor may perform an invasive procedure to obtain a larger tissue sample for a definitive diagnosis. If feasible, the doctor may also remove the entire tumor. There are two types of surgical biopsy procedures. Thoracotomy, open surgery performed in the chest. Laparotomy, open surgery performed in the abdomen. Bronchoscopy biopsy. This involves inserting a thin tube through the throat to detect tumors in the respiratory passages. If a tumor is present, the doctor will take a tissue sample for analysis. Stages of mesothelioma. Based on the size and extent of spread, mesothelioma is divided into 4 stages. These stages help doctors understand the progression of the cancer cells and the patient's life expectancy, and determine the appropriate treatment methods. Here are the stages and life expectancy figures for mesothelioma patients. Stage 1. The tumor is still localized to one area of the body and has not spread to other tissues or organs. In this stage, the life expectancy of the patient is 21 months or more. Stage 2. Cancer cells have grown and started to spread to nearby areas, with a life expectancy of 19 months or less. Stage 3. Cancer cells have spread to surrounding organs, with a life expectancy of approximately 16 months. Stage 4. Cancer cells have spread to various areas throughout the body via the bloodstream. In this stage, the life expectancy of the patient is very low, around 12 months. Treatment for mesothelioma. Mesothelioma is a malignant cancer and currently does not have a cure. Treatment aims to alleviate symptoms and prolong the patient's life expectancy. The treatment methods are determined based on several factors, including age and overall health condition of the patient, type and location of the cancer, size and extent of cancer spread. Based on these considerations, some treatment options that may be recommended by doctors include: chemotherapy involves the administration of drugs to kill or inhibit the growth of cancer cells. This therapy can be done before surgery to shrink the cancer cells for easier removal or after surgery to reduce the risk of cancer recurrence. Radiation therapy involves using X-rays or proton beams to target and destroy cancer cells in the affected area. This therapy is usually performed after surgery to eliminate any remaining cancer cells. Radiation therapy can also be used to relieve symptoms in advanced stage cancer patients who are unable to undergo surgery. Surgery can be performed for early stage mesothelioma. There are several surgical options available, including surgery to remove as many cancer cells as possible from the patient's body. This procedure may be supported by radiation therapy to alleviate pain and inhibit cancer growth. Surgery to drain fluid from the chest that impairs breathing. This procedure may be accompanied by pleurodesis, which involves injecting medication into the chest to prevent fluid buildup. Surgery to remove affected tissues around the abdominal cavity, ribs, or lungs. Surgery to remove the affected part of the lung and surrounding tissues. This procedure is typically followed by radiation therapy. Multimodality therapy. This therapy involves a combination of 3 or more treatment methods, such as surgery, postoperative chemotherapy, and radiation therapy, to increase the success rate of treatment. To aid the treatment process, doctors may recommend the following for patients: breathing exercises to control respiration when experiencing difficulty breathing. Body relaxation exercises reduce tension in the respiratory muscles, making it easier to breathe. Complications of mesothelioma. As mesothelioma grows or spreads, it can compress surrounding organs or tissues, leading to various complications. In pleural mesothelioma, the following complications may occur: difficulty breathing, chest pain, difficulty swallowing, nerve and spinal cord pain due to pressure, pleural effusion, fluid buildup in the pleural cavity. In peritoneal mesothelioma, a complication that can occur is bowel obstruction, characterized by nausea, vomiting, constipation, and loss of appetite or feeling full quickly. Prevention of mesothelioma. The primary way to prevent mesothelioma is to avoid contact with anything that contains asbestos. If you work in an environment with a high risk of asbestos exposure, it is important to follow the established occupational safety regulations, such as using personal protective equipment while working in areas susceptible to asbestos exposure, properly disposing of asbestos-containing materials in a safe manner that does not pose a risk to the surrounding environment, avoiding bringing home clothing and shoes worn during work. In addition to these measures, there are several other things that can be done to reduce the risk of mesothelioma, including undergoing regular health checkups to detect symptoms or signs of asbestos-related diseases, quitting smoking, as smoking can increase the risk of various types of cancer, including mesothelioma, following guidelines on how to handle asbestos safely. It is important to note that even with preventive measures, the risk of mesothelioma may still exist for individuals who have had past exposure to asbestos. Therefore, it is crucial to maintain awareness and seek medical advice if any symptoms or concerns arise. If you found this video helpful, please consider liking it to support the channel. Let me hear your comment below. May you and your family always be in good health and prosperity. Have a nice day.